Vitaly, Dr. Garibo talked before in this informed consent about function. How do you set realistic goals for your patients as far as functional goals are concerned?
I can't agree anymore with what Chris said. I think the name of the game for our patients is function. I think the absolute number on the pain score, be it 8 or 9, or sometimes you look at the patient who is sitting comfortably in front of you in the chair and tells us that the pain is 10 out of 10. I typically do not get in any kind of discussion or controversy about the score. I'd rather ask the patient what the patient wants to accomplish. Whether this is a 75-year-old grandma who wants to attend a baseball game and she's unable because of disabling rheumatoid arthritis. I also would like the patient to take responsibility, and this has been mentioned by Chris and Joe. I want them to enroll in a gentle exercise program. I emphasize gentle because a lot of our patients have musculoskeletal disorders. They cannot start training for the next Olympic Games, obviously, but a gentle, regular exercise program can be very gratifying and helpful in our joint effort to decrease pain and improve function. I also would like our patients to stop smoking. There is very good literature evidence that tobacco increases pain, especially neuropathic pain. I also would like our patients to lose some weight. And we're not expecting for the patients to slim to a Victoria's Secret model. But even losing 10, 15 pounds in somebody whose BMI is excessive can be very effective, especially for low back pain, weight-bearing joints, and so forth. So I try to say that we're forming a team. We're not on the opposite sides of the barricade with you as a patient. But you need to do your part. I cannot do everything for you. Another tool that I use, if I may, I invite family members, their significant others, in this discussion because they observe the patient at home, not me. And I would like to hear that testimony from the significant other that, yes, my wife is doing more than she ever was able to do. So for me, this is the best testimony that we're moving in the right direction.
And I think all of us on the panel would agree, having a significant other or family member come to a visit clearly gives you insight into what happens the other 29 or 30 days of the month outside the time that you're seeing the patient. So I think that's critical.
If I can just add one thing, some great points are being brought up, but what I'd like to emphasize to our audience is that if you can't measure it, you can't improve it. I think you need to quantitate the function. And so therefore, whatever the top 3 physical limitations are, walking, sitting, standing, whatever that may be, put down a number that you're trying to improve upon.
I think that's critically important. I think setting realistic expectations too. I agree, way too often are we treating the number. I hear everyone say, well, I always ask my patient what level of pain they have. It's not about treating the number with chronic pain. And so I think you want your patient not to be focusing on the number either. You want them to experience increased functionality, and sometimes there's going to be a little pain with gain.
I think you said the magic words there, Joe. I wouldn't recommend even asking your patients what your pain level is, what your pain score is. Let's face it, the numerical rating score, any type of a number score, is oversimplification of something that is very, very complicated. And that shouldn't be the focus of the follow-up or the initial intake.